Tell us about your care experience and how it relates to this role. What is your understanding of the role you applied for? What qualities makes a good healthcare? Okay, to be honest, if you apply for any job position and you did not read about the job descriptions, your job roles, your duties, what you are going to do, if you did not read what they listed there, you know, your job roles include or your responsibilities include. If you do not read it, you will not get this answer. If you do not go through the person specification where they say essential criteria, desirable criteria, where they listed what they wanted, you may not be able to answer this question. Okay, so let's get started. Tell us about your experience and how it relates to this role. So it does not matter if you have worked in the care setting before. There is what we call transferable skill, remember. So I'm going to give you two different examples for somebody who has worked in a care setting before, or somebody who have cared for somebody, and somebody who have not, in a different background. Okay, so my care experience, I have worked in the hospital as a healthcare assistant or as auxiliary nurse, where I support the nurses to take care of the patients, reposition the patient on the bed, empty catheter bag, take off the drip if they finish, where I also helped the patient to walk around so they can regain their mobility. I've also worked in the healthcare. I've also worked in a care home where residents living with dementia are being taken care of. Here, my responsibilities is that I offer them personal care. I assist them to toilet. I administer medication. I have been trained to, so I give medication. I engage them in activities. I reposition those residents in bed who have poor mobility, who are not able to reposition themselves. I reposition them depending hourly, or it depends the type of risk they are. I help to prepare their meals, and those that are not able to feed, I assist them to feed. All these are what are my responsibilities in the care home. I'm giving you an example, but these things are responsibilities that we do as a healthcare assistant. Now, all these things are what I'm doing, and I've checked when I was applying for this job, this is what is listed that I would do. So I am coming to do the same if I have the opportunity to work in your care home. If you are not a carer, you've not worked as a carer before, you've not cared for anybody, be it your parent, or remember, if you have not worked in the care home, it is your parent or your grandparent that you took care of. You tell them that your care experience is that you cared for your mom, you give them shower, which is personal care, groom them, dress them up, assist them to the toilet, take them for hospital appointments, engage them in conversations. You go to the pharmacy according to doctor's prescriptions, you give them their medications, and all these things are your experience while caring for your parent, your sick parent. So when you went online before you were applying for the job, you saw the job descriptions and it aligns with the experience you've got so far taking care of your parents. Okay, so if to say you work in the restaurant, you tell them, okay, I've been working in a restaurant, and I think some experience I have working as a waiter or whatever you are working as in the restaurant. I have learned how to communicate properly with the customers so that at the end, the customers are happy, they don't feel offended. I learned how to manage some behaviors of customers who are not willing to follow procedures. Restaurant job is a type of job that faces you with 247 challenges. So it is always busy. So you learned how to prioritize your task. No matter how busy it is, you know what to do first and what to do second. So when I checked the job description, I found out I am a good fit for this, and the experiences I've gathered here can be transferred in healthcare setting. Talking about your experience and how it relates to the role. Okay, I move to the second one. Understanding your role you applied for. What is your understanding? Your understanding about this thing is that you have gone online to read everything about this job, what they said you should have, essential criteria. You must have your English and maths. You must be open to communication. You must be honest. You must be this. You must be that. So you understand what the role says. Now you have to start listing it for them. Then you understand you have to be patient. You understand you have to be open. You understand you have to have good communication skills. You understand you start listing all. So that's why I said if you did not read what the job description says, it may be difficult for you to answer this question. If they ask you this type of question, they just want to be sure that you know, or that you are the person that applied for this job. So go and check what job position you have applied for, and you have been invited for interview. Go and check. Understand the role you have applied for. As a healthcare assistant, the roles include giving personal care, engaging the resident, helping them to make some movement so they can they will not lose their mobility entirely, supporting the residents in a way that will help them to be independent. If you have been trained to give medication, tell them that you do. All right. You support them emotionally. When residents are showing signs of behaviors, this is what you do and that is what you do. So read what the job position you are seeking for. Read what roles. Read what your duties, your responsibilities are. Now, what qualities makes a good healthcare? As a good healthcare, you are expected to be empathetic, to have empathy, compassion. You have good communication skills. You have to be persistent. You have to be adapt to changes, easily adapting to changes. You have to be open, honest, accountable. You have to, so all the when they ask you about qualities, you see your talent, your skills, and your strength, bring them together, start giving them. These things are qualities.